morning to one and all. I shall be speaking today on Desflurane in our days, uh, based on its precision, performance, and its path ahead. Now, Desflurane, on its precision, I shall be highlighting what exactly, as a practicing anesthesiologist, we should know about this inhalation anesthesiologist. Now, in the last century, a number of inhalation anesthesia gases has been discovered. Desflurane, being the most recent of it, is basically a racemic mixture of two enantiomers which are highly resistant to defloration. Though I am speaking this word recent, but it was synthesized way back somewhere in 1970s. It became available overseas around 1990s, whereas in India it came in the year 2010. So it's almost been 15 years since when it has been evident in our subcontinent. However, this inhalation anesthetic has faced its own challenges. The synthesis is very difficult. Maintenance, it is very volatile and starts boiling even at room temperature. And last but not the least is its cost. In the last decade, a lot of emphasis has been given on safety of anesthesia. But with that, the last decade has also been the decade of rapid recovery. Here, Desflurane wins all the races. Its low solubility causes rapid induction as well as rapid recovery. Time is something which we all are lacking. Patients come to us asking how fast they can return back to their daily works. This is where Desflurane wins all the races. It has, however, approved only for maintenance in anesthesia in adult and pediatric patients. Mechanism of action still remains unclear for most of the inhalation anesthetics, and it is usually by activation of the inhibitory channels and blocking the excitatory ones. I will not go into the details of the physical properties, but what comes of importance in this figure is it has a saturated vapor pressure which is very near to the atmospheric pressure, and its boiling points is within the room temperature. Thereby, it is a very volatile inhalation agent which starts to boil even in our room temperature. This special characteristics makes the requirement of a temperature controlled, pressure regulated vaporizer, and hence Desflurane vaporizers are electronically powered with heat devices. It maintains a pressure for somewhere around 1500 mm of Hg, around 2 atmosphere, and warms it to 40 degrees Celsius, thereby controlling the concentration of the inhalation anesthetic that needs to be delivered to the patient. It has a pungent odor, hence cannot be used for induction. MAC is somewhere around 6. Induction and emergence due to its low solubility is very rapid. Emergence from Desflurane is somewhere around 6 minutes compared to sevoflurane, which takes around 18 minutes. Can be safely given in renal patients, also safely in pregnancy as well as breastfeeding patient. However, in pregnancy, the dose-related uterine atony is still there. In children, it can induce coughing, secretions, and laryngospasms. Slightly about its adverse effects, like all other inhalation agents, it is a potent vasodilator and decreases the SVR, which causes a decrease in blood pressure. However, cardiac output is usually maintained due to a compensatory rise in heart rate. Rapid increase in the dose of Desflurane can cause an increase in heart rate and blood pressure, which is very similar to the action of ketamine. It causes catecholamine release. However, again, it is easy to titrate. In CNS patients with requiring neurosurgery, it can cause an increase in intracranial pressure, so best is to avoid. In the last lecture, we had a lot about the rocuronium and sugammadex. Now, rocuronium, sugammadex, Desflurane, these are the agents and the drugs which are being used for rapid recovery. However, this has to be kept in mind that Desflurane often enhances the effect of rocuronium. Now, this one is very rare, but it's life-threatening. Desflurane along with succinate and choline can induce QTC prolongation, hyperkalemia, and very rarely malignant hyperthermia. In patients who are already having liver problems, desflurane needs to be used with caution as it can lead to produce hepatitis. Although rare, severe hepatic injury can follow due to massive hepatic necrosis. The mechanism is usually immunological. Sometimes increased blood glucose level and increase in the total counts can take place. Desflurane again is the most likely inhaled anesthetic to result in carbon monoxide production compared to sevoflurane as well as isoflurane. Production of carbon monoxide is usually by degradation of desflurane by desiccated CO2 absorbent, mainly barium hydroxide lime. To summarize, as a practicing anesthesiologist, whenever we are using desflurane, it is best to remember this rule of 6. This summarizes its entire effect. So the rule of 6 says its physical properties where there is 6 fluoride atoms. Oil gas partition coefficient is 18, blood gas partition coefficient is 0.42, and blood brain partition coefficient is 1.2. All are either multiples or dividends of 6. Saturated vapor pressure for desflurane, different books gives different things. Some give 681, some give 663. But if you remember 666 or else something which is very near to the atmospheric pressure is enough and has a boiling point of 22.8 degrees Celsius. I have rounded it to 24, which is again a multiple of 6. So if we can remember this, then we can remember the rule of 6. MAC value is 6%. We use a Tech 6 vaporizer for desflurane. Maximum dial setting is 18. Administration of desflurane, what the company usually recommends is to maintain initially a fresh gas flow again of 6 liters. 3 liters of oxygen and 3 liters of any of the either gases, either oxygen or nitrous oxide. And then you put the dial setting initially to 2%, and with every 2 to 3 breaths, increase the dial setting by 1%, reach till 6%, and then provide the same with the same gas flow for 6 minutes. This will help to achieve the MAC of sevoflurane. So this 6 points summarizes the entire desflurane and the rule of 6. Coming to the last part, this is entirely of my opinion, and I would like to invite discussions regarding this. The path ahead for desflurane, to my opinion, is more of thorns rather than petals. The first factor is cost. In days where you have patients who are requiring, most of the patients which are coming to us are having schemes and all. So here cost is very important, where we are getting other inhalation agents almost on 1/3 or half of the cost. Desflurane probably loses the race. Complexity of this inhalation agent is another important thing. It is a very complex, it starts to boil even at room temperature. Its vaporizer requires to be heated. It just cannot switch it on. So these are the complex. Carbon monoxide poisoning I have already mentioned. The last part is something which is known as carbon footprint. When we were studying, this carbon footprint did not come in our mind. It is probably for the last 6-8 years something which is known as carbon footprint is coming. Now what exactly is this carbon footprint? Now if we go back, probably everyone knows there is something which is known as global warming. Global warming is nothing basically that the earth's temperature is slowly increasing. Now one of the most important determinants of this global warming is the greenhouse gases. What are the greenhouse gases? Very simple. These are the carbon dioxide, nitrous oxide, methane. These are the simple greenhouse gases. By carbon footprint, we mean how much of the human activity is actually contributing to produce these greenhouse gases. CO2 equivalents. This can be anything. driving of a car. This can be using AC machines, using refrigerators. Now, how much of this carbon footprint is produced with the use of desflurane? So it says that 1 hour use of desflurane can cause to release the amount of carbon footprint or the amount of carbon dioxide which is produced by driving a car for more than 100 miles. So this is the research. So if you are using sevoflurane at 1 mach for 1 hour, you are driving a car almost for 6.5 kilometers. For isoflurane, it is 14 kilometers. Nitrous oxide is 95 kilometers. And desflurane is around 320 kilometers. This is something of real concern in our days. To me, I would probably reserve the usage of these versatile inhalation agents only for daycare procedures, severe obesity, and for bariatric surgeries. Thank you.